Hi, everyone. This is Swapnil Agarwal, one of the co founders of Cardiac Cares Foundation. Today is a moment of immense pride for not only me, but our whole team, because on May 15th, we are inaugurating a completely free healthcare clinic for the public. Access to healthcare. This is a topic that it's been debated on for many years. Currently, also being people talk about it. And as an immigrant that moved to America in late 90s, we realized how difficult and how not easily accessible access to healthcare is for general public. Having health insurance, it's so important in this country. And if you don't have health insurance, seeing a doctor or even a nurse, it becomes so difficult. So we wanted to play a part in that and help the society in the ways we can and we know the best. And to do that, we are opening a completely free healthcare clinic in the city of Houston. It's the same city of Houston that has given an immigrant like me a platform to succeed and establish a company like Nitya Capital in Cardiac Property Management to be successful. And it becomes our civic duty to give back to the society. And what better way than opening a completely free healthcare clinic? And especially given the circumstances we face today in the last year with COVID, has been such a difficult year for not only Americans, but public all over the world. And it makes us step back and realize how important role the health plays in all of our lives. We take the health for granted, but there are many cases where you could be the richest person, you could have the best job, but if you don't have access to healthcare, everything else is meaningless. A lot of times, when people feel sick or they have issues, whether they have heart disease or whether they're not feeling well, majority of the times they just need some consultation. They just need help. They just need to talk to a doctor. They just need to talk to a medical professional. And that's what we're going to provide through this free healthcare clinic, where people can walk in without insurance, without any money, and have full-time nurse practitioners. We have several doctors who are so kind that they're volunteering their time towards this initiative. The goal is, this is the first of many healthcare clinics that we open. The goal is, the vision and the dream is to have several healthcare clinics in each city, and hopefully several healthcare clinics in each city all over the country. And with that, I'll sign off and just say that how proud I am of this initiative. And hopefully the people of Houston, the city of Houston, the public can use this facility, and we can keep expanding on that. Thank you so much.
Each year in the U.S., $3.7 trillion is spent on healthcare, with $10,500 spent per person on average. In fact, healthcare spending is almost 20% of the U.S.'s GDP and continues to rise. Only 8% of adults 35 and older are able to receive priority preventative care treatment. Today, 40% of adults are obese, and the statistic will reach 50% by the year 2030. Obesity is a major precursor to health conditions including heart disease and type 2 diabetes. In fact, over 25% of deaths each year in the United States are directly attributed to these issues. Even our children are being affected at early ages with these health conditions, and so there is a rough road ahead for the next generation to come. Where are we supposed to go from here? The answer lies in what we can accomplish with just a bit of knowledge and dedication. We can start with a plant-based diet with clean foods that are not artificial, non-GMO, and don't have refined sugars and processed ingredients.
Hi everyone, I'm Dan Hooper, friend of Nitya Capital and Vivek Shah, here to share my personal health story with you. I hope you're enjoying the event and are excited to implement all the initiatives that Cardiac Cares is sharing with you. My history is one of bad genes, high blood pressure, high cholesterol, high liver enzymes, basically a daily battle without much success. After speaking with Vivek and hearing about all the success that he's seen, I decided to take a shot. A bit speculative, but I jumped in and basically made 5 easy changes to my daily routine. Eating plant-based diet, eliminating processed foods, intermittent fasting, mixing and exercise 3 to 5 days a week, and upping my water intake, And within a few months, the changes I saw were dramatic. Not only qualitative, from waking up with more energy and excited about chasing my 3 kids around, but also quantitative. I had triglycerides of 600 plus, A1C levels of over 6%, which are considered pre-diabetic. Total cholesterol in the high 300 range, and liver enzymes around 160. Within a couple months of making these changes, it was pretty amazing to me. My triglycerides were cut in half to less than 300. My A1C levels were high 4s, which is no longer pre-diabetic. My total cholesterol was down to 200, and my liver enzymes, which I had no success with lower in the past, went from 160 down to 58. So as you can see, it's been super beneficial for me and my health and my family. I hope you guys will join me in this and see continued success as well. So join me and let's redefine healthcare together.
If we increase mental health improvement, stress management, and exercise, we can grab hold of this issue and conquer it before it takes root. Our clinic is consistent with what Benjamin Franklin once said: an ounce of prevention is worth a pound of a cure. Our mission is to educate, strengthen, and encourage every patient who walks through the door to receive 100% free healthcare and facilitate breaking the current cycle. Together, let's redefine healthcare.